represented by our able HR, Pharmacy Lukman Abdurrahman, our HOD, Marketing Department, HOD, Psychology, Student Affairs, present, our able Deputy Registrar, all academic departments, I'm the head of academic, Mr. Halidu, Ms. Jumoke, and Department of Director of Operation, everybody by our secretary, my able lecturer, Mr. Yusuf, my departmental lecturer that happened here, Mr. Moses, CEO office, Ms. Hawa, our able lecturer too, Mr. Topman, and Ms. Diane standing outside. All students present, you all are highly welcome. As you know, this is traditional for foundation students. Every semester, we must carry out these activities to test our students, to see whether we, the lecturers in the department, we have impacted them or not. Although this type of presentation, we term it as project and term paper. They did not actually go out to do any research. They sought out something from the internet to see what they can do, which I believe after foundation, they will be able to come out with something tangible during their final year project. Which some of them always say that they are going to work on this thing toward their final year to carry it out as their final project. These people here, this is our final year intake for July 2023 intake, and this is their final semester, also their final presentation. There are just few of them, so this time around it won't take much of our time. We believe before 1 o'clock or very fast, we should go to round of the program. Please, they are just incoming students, just someone that just graduated from the secondary school, now preparing the entire 100 level. But we are just trying to see what they can do, not that they are actually perfect. Anywhere they have pressure, please, we just read them everything. So without losing much of our time, we would like a welcome address from our CEO, represented by HR, to also come up before we start the program. Thank you, sir.
Good morning, everyone. Good morning, everyone. Good morning, foundation students. Please don't touch the wrong bell. Before you now be saying with his glasses now, we're asking questions. Please, we are all friends. Okay? All right. The lecturer, let me say able lecturers, the faculty members rather, the management of Lincoln College of Science, and of course the Lincoln University, you are all welcome to this wonderful edition of foundation students, the semester presentation. I hope you all prepared. I hope you all prepared.
Yes, sir.
All right. Thank you once again, and I hope we enjoy this wonderful activity. Good morning to everyone.
Thank you very much, my able CEO, represented by HR. Please, we are going to give other management staff to address us immediately after the presentation so that we can see where to improve ourselves and another observation. So, for the July intake, here are your mark. Dress code 5%. Dress code 5%. Mode of presentation. You guys know the way I lecture in the class, right? You can perform more than that. 5%. PowerPoint. You know, last time some people just do anyhow PowerPoint this time around. This time around we decided to give PowerPoint 10% with your reference intact. If you have reference that is not intact, that means you are losing your mark. I think I'm taking my time. For those people that came to me, we'll take our time to sort out the reference. But some of you feel that the reference is not important. But this time around, we are going to show that the reference is very, very important. If your reference is not correct, it means you are losing marks. So PowerPoint, 10%. Also how you do your PowerPoint, your image, if your image is have clarity, fine. You can't be talking about microscope, then you are putting stethoscope there. So your image must align with your content. Then, content 10%, which is how are you able to source from different places. Some people just went to one place and copy the whole topic and make it as PowerPoint. No, you must source from what? Different places, which means at least minimum of 4 places. Then, content 10%, which means address code 5%, mode of presentation 5%, PowerPoint 10%, content 10%, total 30%. And please, you just have 5 minutes for your presentation. Summarize all your work within 5 minutes. As you guys know me, the moment your stuff is not making sense, you can come to each other later. And when it's the time up, please just go for conclusion. Are we together? Your presentation can still make sense because management are having meeting by 1 and I have to round up this thing before 12:30. Are we together? The moment we said time up, just do a conclusion. We still have a PowerPoint with you where the judges is going to look at your PowerPoint. So please, the moment you just say conclusion, just go to the conclusion, don't argue. Are we together? So we are starting with our first presenter. We have Silas Smith was there as our first presenter. While Precious in the should prepare. Thank you.
Good morning, my CEO, HR, my HOD, and all the staff present. My name is Hussein Smith Silas, and I'm here to present a term paper on spinal stenosis. So quickly, let's look at what spinal stenosis is. So spinal stenosis is the narrowing of one or more spaces in the spinal canal. The spinal canal is a tunnel that runs through all the vertebrae, each and every vertebrae in the spine. It contains the spinal cord. Now, if there's less space or have it tightening the spinal canal, it can lead to cramps, compressions, irritations that can cause severe pain on the spinal cord and the nerve roots. Types of spinal stenosis. Now, according to Cleveland Clinic and Johns Hopkins, spinal stenosis is divided into 2. We have cervical spinal stenosis and the lumbar spinal stenosis. Now, the cervical spinal stenosis is the stenosis that affects the neck region of the spine, while the lumbar spinal stenosis affects the lower back region of the spine. Now, note that all spinal stenosis can affect every part of the spine, but it's majorly on the cervical and the lumbar parts because of the crowded nerves that are found in the neck region and the lower back of the spine. Symptoms of spinal stenosis. Now, depending on where and how severe the spinal stenosis could be, patients might experience these symptoms in the following places like the neck, back, arms, legs, hands, and feet. Now, these symptoms could be mild or severe depending on how and where the spinal stenosis is. Now, the symptoms include pains all over the cited area, numbness where the patient can't feel either his arms or legs. Then we have tingling. Tingling is a pinching sensation that the patient feels. Then we have weakness. Those are the symptoms. The causes of spinal stenosis. According to Mayo Clinic in 2018, we can generally group spinal stenosis into 2 groups. That's the causes. We can group the causes of spinal stenosis into 2. Now we have the acquired causes and the congenital causes. The acquired causes are the causes that develop after birth, while the congenital causes are the causes that develop before birth or during fetal development. An example of some of the acquired causes could include bone overgrowth, which is just improper development of bones that could lead to spinal stenosis. We have bulging or herniated disc. Now, the bulging or herniated disc is also a spine condition that occurs that affects the spine. Sorry, previous slide. Now, the bulging of herniated disc is also a spine disease that affects the spine, that affects the cartilage that are all stacked up between the vertebrae in the spine. We also have thickened ligaments. The ligaments are what help the vertebrae to stay in place in the spine. So when the ligaments get thickened, this could lead to wear and tear, which can also cause spinal stenosis. We have spinal fractures or injuries which could be as a result of accidents. Then we have spinal tumors, which are outgrowths, cancerous or non-cancerous, that could affect the spine and also cause spinal stenosis. We have the congenital causes. Now, these congenital causes, like I previously said, are the causes that develop before birth or during fetal development. Now, we have issues with spinal formation during fetal development. So, as the fetus is being formed in the womb, there are cases where the spine could be formed improperly, leading to spinal stenosis. We also have genetic or inherited conditions that can also cause spinal stenosis. Example of these conditions include spinal dysplasia, achondroplasia, or osteopetrosis. Next slide. Diagnosis and test. So how do we test and diagnose for spinal stenosis? There are just two major tests for spinal stenosis. The first is the physical exam. This is just the medical practitioner trying to examine the patient in order to find out what is wrong and what adequate treatment needs to be given. Then we have the imaging tests. There are three of them: the CT scan, which is the computated tomography scan. Then we have the MRI, which is the magnetic resonance imaging, and the spine X-ray. All these scans are just to help give the medical practitioner a detailed internal image of the spine in order to find out what kind of spinal stenosis we're dealing with and how we can be treated. Next slide. Management and treatment. Now, like I previously said, the symptoms of spinal stenosis could be mild or severe. So depending on how severe the spinal stenosis is, we consider these following treatments. At-home care remedies, oral medications, and physical therapy can be used to help treat spinal stenosis that are not severe. So these are the symptoms, in the sense that the symptoms of the spinal stenosis are mild. We have at-home remedies, care remedies like massages, hot and cold therapy. We have oral medications, and we also have physical therapy like fitness exercises that could help strengthen and help for fitness. Then we have steroid injections and spinal surgery. These steroid injections and spinal surgery comes in when the spinal stenosis is already very severe. So in conclusion, spinal stenosis can affect anyone, but it is mainly common with people over the age of 50 because spinal stenosis is as a result of normal age-related wear and tear. So we cannot totally prevent spinal stenosis, but we can manage. And
do you do pause or stop?
We can take the management steps that will help us to risk, our lower risk to having spinal stenosis and slow the progression of spinal stenosis. Thank you.
Any question from the staff? Observation?
The presentation was actually very good, but the question I have for you is this. You said people that are reliable to have this is people that is at least 50. What if a boy of like 20, 15 has it? What's the cause? What is the problem?
Okay, thank you, sir. Like I previously said in the causes, I said we have two types of causes. We have the acquired and the congenital, which is the one that develops naturally due to conditions. The acquired, now, what you're talking, anybody can have spinal stenosis, like I already said. Now, a person can acquire the spinal stenosis based on the acquired causes. You can have spinal fractures and injuries that can lead to spinal stenosis. You can have bone overgrowth. You can have bulging or herniated disc, which is also, you can have arthritis. Arthritis is also a spine. Arthritis is actually a bone problem, which also affects joints, and there are joints in the spine. So all this put together can cause anyone to have spinal stenosis. But for the natural spinal stenosis that occur as a result of age, as a result of aging. So that is where age comes in. But for anybody else that can gain spinal stenosis, it is through those acquired causes I already mentioned.
Thank you, Mr. Silas. Can you go back to your first slide, please? The introduction part, the HOD, something, Mr. Salim Umar. Okay, it's supposed to be. It's an observation. Earth sciences. Next time, not earth science. Take note. My question goes thus. What is the relation between this spinal stenosis and the osteoarthritis? Is there any relation between them?
Osteoarthritis, I really don't know much about osteoarthritis, but I know about arthritis in general. The relation between spinal stenosis and arthritis can also lead to spinal stenosis because arthritis affects the joints. So once the joints are affected, you could lead to a tightened, spinal stenosis is just a tightened or a narrow spinal canal. And once there's a little expansion of any other or a displacement of the structures in the spine, it could also lead to an expansion or a tightening. So arthritis can cause, because there are joints in the spine. So arthritis can cause spinal stenosis.
So we can easily agree the causes of this is osteoarthritis or arthritis.
No. It is one of the causes.
It's one of the causes.
Yes. One of the conditions that can lead. Just like inherited or genetic.
Okay. I think because of the time, I expected you to make mention of the stages involved in this spinal stenosis, but you couldn't. Or do you ever have any research regarding that?
Research on that.
All right, thank you.
I was thinking, that is I stand to be corrected. I was thinking that at the end of this year, then we will at least make a recommendation for those who are doing this, who don't know anything about it, so that their recommendation will are doing guys, you understand, for people like us, any other person, you understand, who has similar experience, so that as a teacher, that's when you come to work like this, you understand, try to make so that people will not know that this is the kind of might not be interested in looking at the whole of their work. You understand? But that recommendation, somebody can just snap it and key into it. Thank you.
Thank you very much. Can I have your seat?
Good morning, my patron, all staff present and my fellow students. My name is Precious May, and I'm here to present a exam paper titled Epilepsy. Imagine a sudden storm in the brain, disrupting its normal rhythm and causing chaos. This is epilepsy, a neurological disease of the brain that affects millions of people worldwide, yet remains widely misunderstood. Today, we'll explore on the impacts, causes, challenges, and management of this disease, with the aim of improving our knowledge and on how to provide the right approach when it occurs. The word epilepsy is derived from the Greek word epilamian, meaning to be seized. This term signifies the magical thinking of that people with epilepsy were considered unclean or guilty, and this created the stigma, epilepsy. Recording with over 100 people. Recording with over 100 cases in Nigeria. According to WHO 2018, around 50 million people worldwide have epilepsy, making it one of the most common neurological diseases globally. Epilepsy is said as a non-communicable neurological disease that affects people of all ages. Epilepsy involves seizures which result as a burst of electricity in the brain. The most common cause of epilepsy is genetics. It's been estimated that up to 70% of people living with epilepsy could be able to manage this disease if properly diagnosed and treated, and also providing the right approach when it occurs. Epilepsy is a chronic non-communicable neurological disease of the brain that affects millions of people worldwide. Its primary identifying factor is recurrent unprovoked seizures. Abnormal electrical activities in the brain causes seizures. These activities affect how a person thinks, feels, acts, and behaves. Now, the normal function of the brain involves communication between nerve cells called neurons. Electrical signals are sent from the cell body to the branches of the nerve cells. These signals are responsible for the sending of chemical signals across the brain. Now, seizures occur when there is a an abnormal function within the circuits of the brain, whether throughout the brain or in a localized part of the brain, such that neurons fire off in an abnormal fashion rather. Now, types of epilepsy. The brain is divided into two hemispheres or two halves, and there are two types of epilepsy, characterized by the type of seizures a person experiences. We have focal epilepsy, generalized epilepsy, combined generalized and focal epilepsy, and unknown epilepsy. Focal epilepsy affects one side of the brain, and people with focal epilepsy experience lesser symptoms and may not lose consciousness. While people with generalized epilepsy affects both sides of the brain, and people with generalized epilepsy have more symptoms and it leads to loss of consciousness. Combined generalized and focal is the mixture of both generalized and focal epilepsy. Unknown epilepsy are those that haven't been diagnosed because it is not sure where in the brain the seizure started in. Moving on to the causes of epilepsy. We have genetic factors, head injuries, brain infection, and brain tumors. Brain infections such as meningitis and some parasitic infection may disturb the normal functioning of the brain. Moving on, we have signs and symptoms. So these are some common signs and symptoms that may occur in a person with epilepsy. An aura is usually the first stage in sign and symptom. A person will feel a sense of deja vu, meaning that he or she has been in this situation before, and the person also has odd sensation in his or her stomach and feeling like something is about to happen, and also becoming unresponsive, staring into space, becoming disoriented or confused, hallucinating, stiffening movements, jerking movements, and switching between stiffening and jerking movements. Loss of consciousness occurs if when a person has generalized epilepsy, but when a person has focal epilepsy, there's no loss of consciousness. Then complications. Aside from the negative effect that this disease has left in the life of the victim, there are other serious complications such as difficulty learning. The abnormal studies of electrical activities in the brain responsible for seizures can disrupt the formation can disrupt the connection between neurons. Regular disruption may affect or inhibit the formation of new connections, which may make it difficult for individuals with epilepsy to acquire new knowledge, gain new skill, and also recall previous knowledge. Then breathing in food or saliva into the lungs rather than being swallowed during seizures can cause aspiration pneumonia. Aspiration pneumonia is a condition when a victim of epilepsy breathes in food into the lungs rather than swallowing it, and which can lead to the spread of infection throughout the bloodstream, causing respiratory failure and even death. Next slide, please. Diagnosis. A person can have seizure once in their life, but for a person to be diagnosed of epilepsy, the person must have had recurrent unprovoked seizures. These are the ways in which epilepsy can be diagnosed. We have lumbar puncture. If an infection is suspected as a cause of a disease, a sample of the cerebrospinal fluid is removed for testing. The cerebrospinal fluid is a liquid, clear fluid that flows in and around the brain and the spinal cord. Like the image here, the cerebrospinal fluid is being removed for testing, and also an electroencephalogram (EEG). In this test, electrodes are attached to the scalps record the electrical activity in the brain. The electrical activity shows up as wavy lines on EEG recording. An EEG recording may show or tell a pattern which tells if a seizure is likely to occur again. Then we also have magnetic resonance imaging (MRI). An MRI uses powerful magnets and radio waves to create a detailed view of your brain. An MRI may show changes in your brain which can lead to seizures. Then treatment. There are usually 4 types of treatments for epilepsy, but medications are the usual ones in which doctors use to control epileptic seizures. We have, and they are called anti-epileptic drugs. We have carbamazepine and lamotrigine. Carbamazepine is used to treat certain types of epilepsy in children and adults, while lamotrigine prevents and controls epilepsy or seizures in people with epilepsy. Next slide, please. Then, if seizures continue and side effects becomes unbearable for people with epilepsy who use medication, the doctor will suggest other ways. Another way to treat seizures or epilepsy is surgery. And these are types of ways of surgery that can be carried out. We have lobectomy. Surgeons locate and remove the area of the brain where seizures start. Then corpus callosectomy. This surgery cuts the network of connection between the neurons of the right and the left half of the brain. It is used to treat seizures that start in one half of the brain and progress to the other half of the brain. Earlier I said we have focal epilepsy. This type of seizure surgery is favorable to people that have focal epilepsy because it has only affected one side of the brain. So it cuts the connection of neurons so that it won't progress to the other side of the brain. Then we have electrical stimulation. Electrical stimulation, if the area of the brain where seizures start in can't be removed, then electrical stimulation or a device that provides electrical stimulation will be sent to the brain. We have vagus nerve stimulation. Vagus nerve stimulation, a device implanted underneath the skin of the chest, sends vagus nerves to the neck, which sends signals to the brain that inhibits seizures. Like what's here, this is the generator that is placed underneath the skin of the chest, sending vagus nerves to the neck, which sends signals to the brain that inhibits the seizures, inhibits or suppress or to overtake the seizures. Then we have responsive neurostimulation. A device is implanted on the surface of the brain or within brain tissues. The device can detect seizure activities and deliver stimulation to stop seizures. Then the last type of treatment is the ketogenic diet. According to Book 2018, the ketogenic diet has been used to treat seizures since the 1920s. The ketogenic diet includes high fat and low carbohydrate foods, which alter the way the body produces energy, leading to the production of ketones. These ketones can have a stabilizing effect on the electrical activities in the brain, and it is thought to help reduce the frequency and severity of seizures. Then prevention and control. If you've been diagnosed with epilepsy, the following ways are which can be used to prevent seizures from occurring. Follow doctor's advice and take medications as being prescribed. Don't skip doses. Avoid excess light and stress, and also avoid excess intake of alcohol, and seek doctor's advice before taking or changing medication. Now, before I conclude, I would like to carry out a small practical on how to issue first aids to a seizure patient. Now, this is my patient, and she's having a seizure. She's shaking and she's vibrating. The first thing I will do is to make sure that I get a pillow to put under her head. Put under her head so that she doesn't constantly keep on hitting her head and experience injuries. And also, I'll make sure she's not wearing anything tight. If she's wearing anything tight, I'll loosen her up and turn her to the recovery position like this. I'm carrying her leg like this so that she doesn't roll away. And I also monitor her breath. Check if she's still breathing after the seizure. Seizures are going to last for less than 5 minutes. If a seizure takes more than 5 minutes, please rush the person to the hospital. And if you know that it's the first time the person is having a seizure, also please take the person to the hospital after the seizure. And please don't put anything in their mouth. People used to say that you put spoon in the person's mouth so that the teeth will not close and so the person will not die. Please, it's not right. But in the process of doing that, it will injure the person because the person will be vibrating, his teeth will be gnashing. Thank you. His teeth will be gnashing, so the person might injure him or herself. In conclusion, worldwide, an estimated 125,000 people die from epilepsy each year. These deaths are as a result of neglection, ignorance, and stigma created with epilepsy. Although this thinking has been abolished, people with epilepsy still live with discrimination, and people still die from epilepsy. Epilepsy can be managed if followed with proper care. Please, let's try to prevent further death from occurring. Let there be no discrimination amongst people with epilepsy. Thank you.
Thank you for the wonderful presentation. I'm really impressed with this presentation. Observation, question, and the rest. Observation, question.
Alright, very, very wonderful presentation there. Then we were told that if somebody fall and run away, you understand, it's a normal belief, popular belief that once somebody has seizure, the next thing is for you to run because it's communicable, it's contagious, and all that. So can you clear the air on whether this is communicable or not, so that we know whether to run or to stay if somebody falls down? Thank you.
Epilepsy is a non-communicable disorder. It is not communicable. It is not a virus or a bacterial infection. It is a condition of the brain, so it can't be contacted.
You have that question?
Thank you. Mine is a commendation. You have climaxed my level of impression. I am very, very impressed. If those of you who are at the back, you heard when Dr. and Cornell, my senior colleague, mentioned something, and he said it's good to make recommendations. You would have, even if it's not on your slide, you would have quickly just put it on your mind. So when you come, by the time you are getting to your conclusion, before your conclusion, just say a word or two and say, it therefore must be recommended that families and vulnerable people should make sure that they see their physicians, something that correlates, a recommendation. So I hope those of you who are yet to come will understand the significance of his point earlier. You need to mention recommendation in a good presentation. You, Ibeno, and Osere, Silas, have wowed me, and I am humbled. If I were a young man, I would have trained you. I have a daughter who is a graduate. She's a thespian. And if I was a young man, I would train you until you finish university so I marry you. Just like I would have done to Osere Silas. As a young, I would have trained him until I got him married. I get married to him as a lady.
Thank you, Precious. If I may ask you, you said seizure or epilepsy is not contagious, right? Okay, good. So what is the relation between epilepsy and convulsion?
Convulsion is a seizure. It can be said as seizures. When a person starts having symptoms of seizures, can be said as a person is convulsing. The person starts shaking, jerking, or vibrating. That's what.
Again, they are not clear.
When a person is having convulsion, it's also said as a person having seizures. Seizures is the outburst of electrical activities in the brain, leading to symptoms such as jerking, shaking, and also disorientated activities.
So what is convulsion?
When a person is having seizures, it's said as convulsion.
There is a word that you need to mention that will make that definition to be inclined or accepted. you know what you are saying, but we listener, we don't get you right. So, difference between is convulsion a seizure?
Yes, no, it's a.
Are they the same thing?
They are the same thing.
How? Why? When?
The seizure can be said as a condition. The convulsion is like what the person is having or what is manifesting.
Okay, thank you so much. Basically, what you are trying to explain, jacking, that's what I want you to say. Jacking is convulsion. The jacking action, the involuntary action you are doing during the seizure is convulsion. All right, thank you for the wonderful presentation.
Thank you very much. As I said earlier, every year in, year out, we take correction. Like as Dr. Ibe have said earlier, based on the recommendation. As I said, these people are just coming up.
Good evening, my HOD, all staff present, and my fellow students. I am Martin Peace, and I'm here to present my topic about breast cancer. Do you know that black women are more likely to die from breast cancer than any other race? Over the years, breast cancer has been diagnosed as the most frequent cancer, and we have about 500 cases in Africa. Sit back as I enlighten you and show more light on this. Breast cancer is a malignant tumor that starts in the cells of the breast. A malignant tumor are cancerous tumors that grow rapidly and spread to other parts of the breast. So here, the abnormal cells, they grow out of control, and if not checked, can become fatal. This disease occurs in women, but men can get it also. Types of breast cancer. There are various kinds of breast cancer, but we have few listed here. We have the ductal carcinoma in situ, DCIS. We have the invasive ductal carcinoma, metastatic breast cancer, inflammatory breast cancer, recurrent breast cancer, male breast cancer, lumbral carcinoma in situ, SIS. The DCIS is a non-invasive cancer where the abnormal cells have been found in the lining of the breast. Now, what I mean by non-invasive cancer, it means that they just grow and stay in the milk duct, as we can see from this slide. They do not grow out. But if these are let to stay without being checked, they can now start spreading to other parts of the breast tissue. Next. The invasive ductal carcinoma. This is the type of breast cancer that 50 to 80% of breast cancer diagnosis. This abnormal cancer cells begins to leave the breast ducts, the breast milk lining. This one spread out because they are invasive. According to Wright, he established the fact that this is the kind of breast cancer that can affect men. The inflammatory breast cancer is a fast and aggressive growing breast cancer in which the cell inflates the skin. Now, in this kind of breast cancer, there are no lumps found. As you can see, it starts with a reddish patch on your breast, then it begins to expand, and it grows very rapidly in the space of 1 to 4 months. The metastatic breast cancer. This is the advanced kind of breast cancer. It spreads from your body to other parts of your body. It can go from your brain to your lungs, to your liver, and to your bone. It has some kinds of symptoms such as sudden pain, bone numbness, coughing, sweating, swelling, and so on. Signs and symptoms. What are the signs for you to know that you are having breast cancer? Number one, we have the lump in the breast on the armpit area. PS, not all lumps can be cancerous, but it is likely that 80% of the lumps found in the breast can lead to breast cancer. We have nipple discharge, having whitish fluid, or in most cases, blood discharge from your nipples deeply. This is a situation whereby on your breast you just notice that a particular place has been inverted. It goes inside like a dimple here. Nipple changes, including the direction. That means you can have your nipple being inverted or diverted. It changes the shapes. Then we have changes in the breast size. Your breast color starts changing, changes in your skin texture, and you have nipple pains regularly. The risk factors. Now, what are the risk factors or things that can increase your risk of having the breast cancer? And under this, there are some factors you can change, and there are some factors you cannot change. The ones you cannot change is getting older. It has been proven that the more we grow older, the more chances we have of having breast cancer. So you cannot change that fact. You can't stop growing. We have the genetics mutation. This increases your inherited genes. If you are from a family that they have over 50 cases of breast cancer, just know that there's nothing you can do about it. We have reproductive history. Now, for young ladies who start their menstrual cycle before 12, or people who start their menopause before 44, you can have breast cancer. We have the personal history of breast cancer that are likely to record. Now, exposure to the drug diethylstilbestrol. This happened in the 1950s to 1980s when they were giving them pregnancy pills to stop them from having miscarriage. Over the years, Julie established the fact that it started to make them to have breast cancer at the older. Now, the factors you can change: not being physically active. For those of us that don't like exercise, just like being so lazy, you can have breast cancer because there are some hormones in your body that are not overdue, so you need to exercise. We have being overweight, taking hormones, reproductive history of not breastfeeding. There are also some women who do not like to breastfeed their children after a year or before a year, like 6 months, they stop breastfeeding their child. There are some hormones that have been released, and if you don't breastfeed, it can lead to breast cancer. And we have drinking of excessive alcohol. Men who like to drink a lot, as you get older, you can have breast cancer. Now, with gender, the female gender are the most strongest aspects. It's more likely for a woman to have breast cancer than a man. Next slide. The age, as I said earlier, as you grow older, you have more risk of having breast cancer. About 2 or 3 women with invasive breast cancer are always 55 years above. Harmful use of alcohol. There have been a clear link of alcohol and breast cancer. Alcohol increases the estrogen hormones in your body, leading to a chance of you having breast cancer. Women who drink alcohol have 1.5 times the risk of having breast cancer than those who doesn't drink. Menstrual period. Also, as I stated earlier, for the young girls who, due to circumstances, they start menstruating before 12, you have a risk of having breast cancer. So I recommend that you go see your gynecologist or your doctor to get investigated. Diagnosis. Now, once you feel some kind of the symptoms I mentioned earlier, now you go to your doctor, and these are some of the ways they can investigate the breast cancer. Number 1, we have the mammography. As you can see from the picture, a mammography is a sign that you scan your breast with in order to get a clear picture and detect for this breast cancer. Next, we have the ultrasound. The ultrasound is an instrument that is rubbed around your breast to check if there is a cyst that's being filled, if it's going to be a cyst like a lump or it's going to be a solid tumor. Now, next we have the MRI, the magnetic resonance imaging. As we can see, you are being placed on the instruments, the equipment, and you are being sliding. There it snaps your breast tissues and gets a clear picture of your breast tissue. Next we have the biopsy. The biopsy, as we can also see here, is a needle-like equipment that is being injected into your breast to get out your breast tissue. And next we have the breast self-exam. Now, this one you can do it at your comfort of your home. So for ladies or a guy, the first step, as you can see, is to stand before your mirror, holding your hands on your waist to check if there's any sign on your breast, to check if you have any dimpling, to check if you have any spots, and if your nipple is inverted or retracted, standing like this. Then the second step is to raise one arm, your left arm, over your breast, and use your hand flat like this to press around your breast to look for any sign of a lump or a fluid. then it's advised that to check for a lump, you lie down, because when standing, you might have a lump, but that might not be a lump. So it's advised that if you want to check for a lump in your breast, you lie down flat, using your arm to press around your breast. Then step 4, if you have seen any lump or any dimple, sometimes in the process of pressing, you can have that fluid, or yes, that fluid dropping out of your breast. So you note that. Step 4, using your firm fingers, you press flat on your breast tissues for any slump, lump or pain. Then step 5, you repeat on your right arm. Then step 6, examine your left underarm for lumps. That's checking your underarm area, our armpit area, to see if there's any lump. Next, we have treatment. The first and the most common way of treating breast cancer is by surgery. And under the surgery, we have 2 procedures: the lumpectomy and the mastectomy. Now, for the lumpectomy, this is the removal of the fluid. So you go after you have been diagnosed, and yes, you have the breast cancer. You go and they just remove the cyst, they remove the lump and the cancer tissues. Then the other step, mastectomy, this is the removal of the entire breast. That's why you have some people who go for surgery and they just have one breast remaining. Then next we have chemotherapy. This is using the combination of different drugs to kill the cancer cells or slow down the effect so that you can have and live a longer life. Next is radiotherapy, using high energy waves in order to kill the cancer cells. And chemotherapy, it slows or stops the cancer growth using hormones that grows, such as estrogens, stimulated by the ovaries where the egg are stored. Prevention. From the signs I mentioned earlier, these are the steps you can use to prevent having breast cancer, controlling your weight. So that's been proven that if you are obese and you grow older, there is a higher risk of you having breast cancer. So I advise you to control your weight, do exercise, say yes to fruit and vegetables, watch what you eat, breastfeed with a minimum of a year and 6 months. Limit your hormone therapy, and it has also been proven that those who use birth control, there are some birth control pills that can cause breast cancer. So limit intake of that and quit smoking and alcohol. In conclusion, it's paramount to provide public health care about the awareness of these signs and symptoms, and also understand the need of early detection. Remember, early detection saves lives.
Observation, question, and the rest.
Yeah, I agree with you. So, your first slide. Your first slide. You said black women are more vulnerable, right? What is your source? Where do you get this information from?
I didn't put it in the slides. It was, do you know about breast cancer? So when I went on my research, I used YouTube. Cleveland Clinic on YouTube, their YouTube channel. That's when I saw that if you're a black woman, you have more risk of having this breast cancer. And I also went through other videos of breast cancer patients, and they were mostly all blacks.
Okay, please try to do your research further in order not to elongate this program. I think the white women are more vulnerable, but black are more aggressive when it comes to the developed breast cancer. Black are more aggressive. They can have advanced breast cancer than white women. Not we are more vulnerable. Please research further and come and defend or counter this my point. Thank you.
Thank you very much.
Good morning, our HOD, all stars present, and my fellow students. My name is Lincoln College Abuja, and I'm here to present a paper, Polycystic ovary syndrome, while women have PCOS. Polycystic ovary syndrome is a common hormonal imbalance that affects women of reproductive age. It is an endocrine disorder. It usually starts during adolescence, but symptoms fluctuate over time. PCOS is a leading cause of infertility. In some cases, a woman doesn't have enough hormones, doesn't produce enough hormones to ovulate. and if ovulation does not happen, the ovaries can develop many small cysts. This can cause more problems to the woman's menstrual cycle. It makes her to have irregular periods. The cause of PCOS is unknown, but women with a family history of type 2 diabetes are more susceptible. Types of PCOS we have insulin-resistant PCOS, anginal PCOS, inflammatory PCOS, and multiple PCOS. Insulin-resistant PCOS is one of the most common types of PCOS and occurs because of the high insulin levels in the body. It can also be caused because of metabolic syndrome. Inflammatory PCOS, it results from inflammation in the human body. Inflammation makes it impossible for the body to produce hormones, and this will eventually cause an imbalance of hormones, thereby increasing the rate of androgens in the body. Next, we have post-pill PCOS. Women who abruptly stop oral contraceptives completely are also susceptible to PCOS. These symptoms include excessive hair growth, irregular periods, and acne. Next slide, please. Anginal PCOS. The main cause of anginal PCOS is stress, how our body responds to stress, and it's also women who are suffering from anginal PCOS will also have higher levels of stress. Next slide. The symptoms include missed periods, irregular periods, or very light period. In case you notice this, it's important that you visit your healthcare provider. Ovaries that are large or have many cysts, excessive body hair, like I said earlier, weight gain, especially around the belly or abdomen, acne or oily skin. If you notice any acne that is not normal, it's important to also visit your healthcare provider, especially if you've been trying to treat it and it's not going. We have male pattern baldness or thinning of hair. We have small pieces of excess skin on the neck. If you notice that you have skin tags on your necks or your body or any part of your body, please visit your healthcare provider. Next slide, please. During your diagnosis, your healthcare provider will ask about your medical history and how severe your symptoms are. This will likely include a pelvic exam. This exam checks the health of organs, both inside and outside. Some of the symptoms of PCOS are like other health issues. Because of this, you may also need to run some tests like ultrasound and blood tests. Next slide. Treatment for PCOS depends on a number of factors. This may include your age, how severe your symptoms are, the type of treatment your healthcare provider will advise you to go on. We include if you want to get pregnant in the future or not. There's no proven way to prevent PCOS, but you can take small steps to reduce your symptoms. For example, eating nutritious food and exercising regularly, and also managing a healthy weight gain for your body. If you notice that your weight gain is not normal, if you've also been trying to reduce your weight gain and it's being stubborn, you should also visit your healthcare provider. In conclusion, PCOS is a common condition that affects your menstrual cycle. Looking at this image here, you see that PCOS affects a woman psychologically, affects her dermatologically through acne, affects her sleep, affects her cardiovascularly, it can give stroke, it can also give other coronary artery disease. It affects her when she wants to give birth, it makes her to be infertile, it makes her to have numerous miscarriages, it affects her metabolically through metabolic syndrome, insulin-resistant type 2 diabetes, also obesity. Metabolic syndrome is a condition that affects the heart, it causes stroke, and it also causes diabetes. It can affect her psychologically, which means when you see someone like having anxiety, depression, it's not as if the person is just lying or something. You should also advise the person that she should please visit the hospital so that she can get diagnosed properly. Thank you.
Thank you. Question, observation.
Basically, I found it very difficult to read that slide. I can't read it, it's too tiny. It's very difficult, right?
It's not them, it's the projector.
You would have maximized your slides.
No.
Did you notice the spaces? Okay.
All right, thank you.
Please, everyone should clap. Clap, clap. Haven't come to help her colleague with the microphone, apart from her excellent efforts. So I really want to commend that behavior because character leads. Thank you.
Good morning, everyone. Good morning, my HOD. Good morning, my HOD, all staffs present, and my fellow students. My name is Otipo Blossom, and I'm here to present my term paper titled Cerebral Palsy. Cerebral palsy is a neurological condition that is characterized as a group of disorders which affect your ability to move, your posture, and coordination. It is due to damage to the developing brain, which usually occurs during pregnancy or shortly after birth. Cerebral means having to do with the brain, while palsy means paralysis to any part of the body. Types of cerebral palsy. There are 4 main types of cerebral palsy. First is spastic cerebral palsy. Spastic cerebral palsy is described by what part of the body is affected. Spastic diplegia occurs when there is muscle stiffness, mainly in the legs, with the arms less affected or not affected at all. Spastic hemiplegia occurs in only one part of the body, could either be the left part of the body or the right part of the body. Spastic quadriplegia affects all parts of the whole body, that is the arms, your legs, and trunk. The trunk is the main part of the body that contains your chest, your abdomen, your pelvis, and your back. Next type of cerebral palsy is dyskinetic cerebral palsy. Dyskinetic cerebral palsy refers to movements that are involuntary. People with dyskinetic cerebral palsy have problems controlling their heads, arms, legs, and feet, making it difficult to move around or sit even. The involuntary movement in dyskinetic cerebral palsy occurs when could happen and sometimes triggered. The movement in dyskinetic cerebral palsy happens when he or she is excited, agitated, or even tired. Next slide. Ataxic cerebral palsy. Ataxic simply means without order or coordination. Ataxic movement is characterized by clumsy movements and instability, that is lack of balance. The incoordination in ataxic patients occurs when he or she tries to perform voluntary movements like walking or simply trying to grasp an object. Hypotonic cerebral palsy occurs when your arms and legs move very easily and appear floppy. As shown in the image, the baby has no control over their body and they could barely sit up straight. Next slide. Cerebral palsy has several signs and symptoms. Some affect movement while others affect certain body parts. For example, excessive drooling, difficulty swallowing, delay in reaching speech development, delay in reaching motor skills like crawling, holding up color pencils, sitting up straight, difficulty speaking. Causes of cerebral palsy. Like I mentioned in my introduction, an injury to the developing brain can cause cerebral palsy. That is the damage that affects the part of the brain that controls movement, posture, and coordination. Those possible causes are intracranial hemorrhage or bleeding into the brain, head injuries as a result of a car accident, fall, or even child abuse, infections acquired in the womb such as German measles and chickenpox. Then a healthcare provider can diagnose cerebral palsy using a combination of methods and tools. First on the list is electroencephalogram. This is when your doctor attaches small sensors to your head to control or to rather record the activities of your brain. MRI scan, magnetic resonance imaging, can only be used when the causes of the signs and symptoms are unknown. It is used to identify brain injuries like concussion, stroke, and seizures. CT scan, serious like this. CT scan is a computed tomography which reveals brain damages. It is a clear cross-sectional imaging of the brain. Ultrasound is basically to monitor the well-being of the baby while still in the womb. Blood tests for cerebral palsy. Doctors take blood from under the newborn's feet in order to rule out possible conditions like bleeding disorders, for example, sickle cell, nosebleed, meningitis. Next slide, please. Treatment. The possible treatments depend on several factors, and some of the treatments include assistive aid. This is basically to help you perform normal activities if you find it difficult. Like eyeglasses, they are recommended to you if you find it difficult to see properly. Hearing aids are issued to you when you cannot hear properly. Body braces, wheelchairs, leg braces are used to improve movement with your legs. Speech therapy helps to strengthen muscles for speech. They help to strengthen the muscles for speech. Occupational therapy, physical therapy is used to improve movement with your legs and further prevent movement problems from getting worse over time. Prevention. The majority of conditions that cause cerebral palsy cannot always be prevented. However, if you're planning to get pregnant or you are already pregnant, it is advised to get vaccinations against possible conditions that could cause fetal brain damage, like infections through the womb, like asphyxia, that's lack of oxygen that flows through the womb, chickenpox, German measles. It is also important to schedule frequent checkups with your doctor to avoid complications before birth and after birth. There is no cure for cerebral palsy, but some of the effects can often be managed, and many complications can be prevented or delayed. The specific type of treatment varies from person to person. Some people with cerebral palsy may not need very much assistance, while others might need extensive long-term care for their symptoms.
Thank you. Observation, questions? The slide.
What's that her name? Blossom, the Igbo name is. I had Blossom. Chino, you're such a brilliant speaker, like the previous ones, if not better. Don't be nervous. You are great. Always fight the nervousness and have control. Okay.
Thank you.
Blossom, can you please step back? Who said they shall not ask? What did you call it? Cerebral palsy, right? Is there a cure to this? There is no cure. The control, what do you mean when the child is already in that stage? Can it be controlled? Because I know of a parent that her child has this. And the last time I checked, the child was 10 years at her den. She was, in fact, they had to take her to, what they call it, these people that when your legs and this thing, what do they call them? Yes, she had to start, she started a section with them. So there's no cure to it. So it's as good as if the child has it. What's the advice from you? Even if the child is a burden, the parents should still.
Therapy is also you can talk to them so you can become more comfortable.
Okay, let me tell you the stage of this child. She couldn't feed, she couldn't talk, she was still salivating, she couldn't stand, she just couldn't do anything. She couldn't just do anything. So at that point, there's no cure. It's just take care of the child till whatever happens to the child.
When monitoring the child, there's really no cure for cerebral palsy.
You said?
There's no cure for cerebral palsy.
Oh my God. All right. Thank you so much. Thank you.
CEO, my esteemed HOD, all staff present, and my co-students. My name is Utupe Tyson, and I'm here to present a term paper titled Sickle Cell Anemia. Sickle cell anemia is a group of hemoglobin-related blood disorder, typically inherited. It is an abnormality in the oxygen-carrying protein hemoglobin found in the red blood cells. More than 100 years ago, our understanding of this disease has evolved tremendously. Recent advances in the field, more so within the last 3 decades, has alleviated signs and symptoms of this disease. This activity reviews the pathophysiology, complications, diagnosis, prevention and treatment of sickle cell anemia, and also highlights the role of the interprofessional team in management of this disease. Let's move on to the causes of sickle cell anemia. Sickle cell anemia is inherited, which means it runs in families. This occurs when a child or a person inherits one hemoglobin S gene from a parent and another faulty hemoglobin gene, such as beta thalassemia, hemoglobin C, hemoglobin D, and hemoglobin E from another parent. Now, this beta thalassemia is a group of inherited blood disorder which occurs when the body does not produce beta globins. And these beta globins, they are like the building blocks of hemoglobin. So when the body does not produce beta globins, it leads to anemia. A genetic mutation causes abnormal hemoglobin, which makes flexible red blood cell turns into rigid sickle shape. And this sickle shape blocks blood flow, which causes pains, complications, and infections. Now let's move on to the signs and symptoms. What do you feel when you have sickle cell? How do your body react to it? We have early symptoms. A yellowish color of skin or white eye that appears when a large number of red blood cells undergoes hemolysis. Now, red blood cells get destroyed even before the body has time to replace them. This destruction is what we call hemolysis. We also have extreme tiredness or dizziness from anemia. That is when the body is not getting enough oxygen because there is low red blood cell in the body. Then we have fever, swelling of the hands and feet, as you can see in the image. Then we have episodes of pain when the rigid sickle cell blocks blood flow. It leads to maximum pain in the body, joint pain, different pains all over your body. Next slide. Other symptoms include stroke, anemia. Anemia is when there is low red blood cells in the body. Then we have frequent infection. Sickle cell infection includes RSV. This RSV is respiratory syncytial virus. It's the lungs and respiratory tract infection. Then we also have Haemophilus influenzae type B. This infection causes pneumonia and meningitis, and also causes infection in the bloodstream. Then we have parvovirus. It's the other infections of sickle cell. This parvovirus causes complication called aplastic crisis. That is when your bone marrow does not make new red blood cells. Then we have delayed growth of puberty, vision problem, your sight. Then we have priapism. That is a painful or prolonged erection of the penis. Next slide. Diagnosis. How can we detect sickle cell? If a person has symptoms of sickle cell disease, your healthcare provider will conduct numbers of tests. We have genetic tests and blood tests. Blood tests, the sickle cell test looks for abnormal hemoglobin in the blood that causes this sickle cell. While the genetic test diagnose the sickle cell, that is if the results are not clear from the blood test, the genetic test will diagnosis. Then the genetic test also tells us whether we have 1 or 2 copies of this sickle cell hemoglobin gene. We have parental screen. This is done by using a sample of either amniotic fluid or tissues taken from the placenta and testing before birth can be done 8 to 10 weeks in pregnancy. Now this amniotic fluid is like slightly yellowish liquid that surrounds an unborn baby during pregnancy. Next slide. This is the screening machine. This machine is called a Gazelle. Next slide. Complications. When a person has seizures, weakness, numbness of the hands and feet, speech difficulties, and loss of consciousness, these are signs of stroke. There are also complications of sickle cell. I'm not trying to say that if a person has stroke, it means the person has sickle cell. No. Any other thing can cause stroke. But from your blood test, it will show you have sickle cell. But the stroke is a complication of sickle cell. Then we also have pulmonary hypertension. When a person has sickle cell, they tend to have high blood pressure, and it's common in adults. Next slide. We have treatment of sickle cell. Sickle cell disease usually requires lifelong treatment. Children and adults with this disease are supported by a team of healthcare providers working at a specialist sickle cell center. So if you continue to have episodes of pain, you'll be given these drugs called hydroxycarbamide. This drug is a group of chemotherapy drugs called an antimetabolite. These drugs help to stop cell making and repair DNA, and they also help us to reduce the frequency of painful episodes. Then if you still experience pain after taking these drugs, then you'll be given crizanlizumab. This drug is given through an injection into the vein. It helps to prevent blood cells from sticking in the inside wall of the blood vessels. Next slide. If you are not close to the hospital, you can manage your sickle cell at home. Do not take painkillers such as paracetamol, ibuprofen. Do not give aspirin to children under the age of 16. Drink plenty water. Use warm towel or rat heated pad to massage the affected area. Like from the other image, the hands and feet were swollen. So you use the rat heated pad to gently massage the affected area. Next slide. Also, sickle cell anemia patients are advised to take folic acid. Folic acid has different benefits, but for sickle cell, it depletes, folates, stores, and reduces the symptoms of anemia. Then we are also, and of recent research is suggested that stem cells and bone marrow are the only cure for sickle cell patients. And this stem cell and bone marrow is considered for children around the age of 16 and younger than 16. And if they have serious complications, that's when they are advised to do a bone marrow stem cells. These stem cells are found in the bone marrow, and the bone marrow is the substance found in the center of the bone that produces the red blood cells. Now we have prevention and control of sickle cell. There are no primary measures available for sickle cell disease, but however, genetic counseling is advised for people who are at high risk of having a child with sickle cell disease. Avoid swimming in cold water. Cold water increases the sickle cell crisis. It increases pain. Then wear warm clothes when there's cold. Next slide. Drink plenty water. Water has plenty health benefits, but I'll just say two. One, it regulates body temperature. It carries oxygen and nutrients to cells. Then manage your stress. Limit how you take alcohol. These measures can only help you to control and keep you healthy as possible. They won't cure your sickle cell. Sickle cell is inherited. It has no cure, but bone marrow is suggested to be the cure, but it is very risky. Next slide. In conclusion, sickle cell causes red blood cells to become misshapen and break down. With sickle cell disease, your blood cells contort into sickle-shaped disease. The cells die early, leaving a shortage of red blood cells. Thank you.
Thank you. Question, observation.
Faith, can we have the slide, the second or third slide? You use unpopular sex symbols. I think your second or third slide where we saw A, B, C, yeah, here, okay. And then you kept aside the XS and the YY, garments, so to say, that crossbreed. So maybe the only lack we didn't see here is the hybridization between the XX chromosome and the, are you there? So that in the next thing you do the next time you do a presentation, make sure we see the XX and the YX cross hybridization, okay? Thank you.
Lecturers, also
staff present, and my fellow students. My name is Umar Farouk Rahama, and I'm here to present a term paper titled Kaposi sarcoma. Before I begin, I would like to drop a little point here. Kaposi sarcoma is a very rare disease. According to Johns Hopkins Medicine, out of 1 million people, six people are likely to contract Kaposi sarcoma in a year. Now let's begin. Kaposi sarcoma is a type of cancer that forms in the lining of the blood cells and lymph vessels. Kaposi sarcoma is a type of cancer that causes growth of cells known as lesions on skin, face, legs, arms. It can also occur in the genitals and also in the mouth. Kaposi sarcoma stems from a disease known as HHV, human herpes virus 8, also known as HHV-8, and also HIV-AIDS. It stems from these two sexually transmitted diseases. In healthy people, this infection might not lead to Kaposi sarcoma because their immune system is still very strong, and it can help to maintain and reduce the effects of HHV-AIDS and HIV-AIDS from turning into Kaposi sarcoma. But if you have a lowered or a weakened immune system, having HHV-AIDS or HIV can later prescribe or transfer into Kaposi sarcoma. Next slide, please. Kaposi sarcoma, the types of Kaposi sarcoma are age-related or epidemic Kaposi sarcoma. Like I said in the previous slide, Kaposi sarcoma stems from HHV or HIV/AIDS. This type happens in people who are infected with HIV or AIDS or HIV/AIDS. Then we have transplant-associated or iatrogenic Kaposi sarcoma. This happens in people that do organ transplants. For example, if you have had an organ transplant, your healthcare provider will recommend immune suppressing medicines that will help your newly transplanted organ to function properly. These immune suppressing medicines reduce your immune system, keeping you at a higher risk of contracting Kaposi sarcoma. Then we have classic Kaposi sarcoma. This type occurs in Eastern Europe, Mediterranean, Africa, and Jewish descent. Endemic Kaposi sarcoma, this happens in the young people of Kaposi sarcoma. Next slide, please. Causative agents, we have ethnicity, sorry. Like I said, people of Jewish descent, Mediterranean, Eastern Europe, and Africa have a higher risk of developing Kaposi sarcoma. Then we have sex. Men and people, AMAB means assigned name at birth, are more likely to develop Kaposi sarcoma according to Medscape 2022. Age, Kaposi sarcoma affects people from ages 40 to 70. Immune deficiency. People with HIV/AIDS, like I said, or people taking immunosuppressant medication after organ transplant are likely to have Kaposi sarcoma. Sexual activity. Unprotected sex can lead to contracting HHV/AIDS or HIV, which will later lead to Kaposi sarcoma if you have a weakened immune system. Next slide, please. Symptoms of Kaposi sarcoma, we have brown, red, purple spots they may be bumpy or smooth, and they can appear in one area of your body or different areas of your body. We have lymphedema, which happens when a lesion blocks your lymph node, leading to swelling of a particular area. Then we have difficulty in breathing or coughing up blood because there are lesions in your lung, blood in your croup known as gastric bleeding, and belly pain from lesions in your belly. Diarrhea from lesions in your digestive system, constipation or vomiting from lesions blocking parts of your digestive system, and mouth pain, those are lesions in your mouth. Diagnosis of Kaposi sarcoma, also known as KS. Taking a piece of skin for testing. A piece of skin or lesion is sent to a doctor, which he tests for signs of cancer. If there is cancer, then it's confirmed that you have Kaposi sarcoma. Tests find Kaposi sarcoma in the digestive system. We have fetal hormone test. This test hidden blood stool. If you send your stool to your healthcare practitioner and he tells you that there is hidden blood in the stool, there are many things that cause hidden blood in the stool. But to say if Kaposi sarcoma is the main cause of the hidden blood in your stool, they go through tests like endoscopy and colonoscopy. Next slide, please. Tests to find Kaposi sarcoma in the lungs. We have chest X-ray, CT scan, computed tomography scan, and bronchoscopy. Now, bronchoscopy, in this test, a bronchoscope is a long thin tube that is going to be inserted into your nose or through your mouth, and then it travels down into your lungs. In this thin tube, they can see the lining of your lungs and to see if you have lesions in your lung, or to take a piece of the lesion to send to the doctor. Next slide, please. Complications of Kaposi sarcoma. If Kaposi sarcoma affects your digestive system to the point where you have internal bleeding, you may develop anemia, second cancer. People with Kaposi sarcoma, especially plastic Kaposi sarcoma, may later develop into a second stage cancer known as non-Hodgkin Kaposi sarcoma lymphoma. Next slide, please. Now, how is Kaposi sarcoma treated? Your healthcare provider will consider several factors while developing your treatment plan. These factors might include the number of lesions you have, their situation, their color, your overall health, and if you have HIV/AIDS or not. Next slide, please. Other treatments may include topical medications, which is drugs, targeted therapy, where they target directly at the lesions or the cells that are clumped up, that are forming the lesions. They target directly at those and remove those cells. Or radiation therapy using ionized radiation to cauterize the cells that are forming massively on your skin. Chemotherapy using of chemicals, surgery, and cryotherapy. Cryotherapy, also known as cold therapy, where they use a freezing temperature on the cells or on the lesion to peel them off from your skin. Next slide, please. Prevention and control. According to American Cancer Society, WHO 2022, the Kaposi sarcoma mostly stems from HIV/AIDS and HAV/AIDS, like I said earlier. So the best and most reasonable form of prevention is to avoid contracting sexually transmitted diseases, especially HIV and HAV/AIDS. If you have HIV, peradventure, or probably if the patient has HIV, highly active antiretroviral therapy HART reduces your risk of developing Kaposi sarcoma and later developing into AIDS. Now, I had an organ transplant. How do I prevent myself from getting Kaposi sarcoma? Talk to your healthcare provider. There are immunosuppressant medications that can protect your transplanted organ and still prevent you from getting Kaposi sarcoma. Next slide, please. In conclusion, Kaposi sarcoma is a rare and complicated disease. It can affect you in various different ways, and there are also various and different ways from which you can contract the disease. For example, like I said, having HIV/AIDS is the main and most popular way of contracting Kaposi sarcoma. Healthcare providers can ease and sometimes eliminate Kaposi sarcoma symptoms, but the condition often comes back. It's highly recommended for you to know about Kaposi sarcoma if you have the condition, learn about and speak frequently to your healthcare provider so you can give you the best and assured and accurate diagnosis and the best course of treatment. Thank you.
Thank you. Is your hand paying you? All right. Question, observation. Mr. Yusuf, you are quiet today. What's the problem? You're not the spirit. All right. Thank you. You can have your seat.
My name is Faith Bonina. I'm here to present the topic citing infertility. According to AAFP, infertility is a condition that enables a couple to conceive after 1 year of unprotected sexual intercourse. That is, after 1 year of having sex without any form of protection, contraceptive, condoms, and couple is still unable to get a child. It is titled infertility. Moving on to the types of infertility. We have 3 types of infertility. We have primary infertility, secondary infertility, and unexplained infertility. What is primary infertility? Primary infertility is the type of infertility that occurs when a couple is unable to conceive after 1 year of unprotected sexual intercourse. Why is secondary infertility? This is when the couple is unable to conceive after one successful pregnancy. Note, after giving birth once or just getting pregnant once and person is unable to conceive again, it is known as secondary infertility. While extended infertility, this This is when fertility test will not find any issue or any reason why the couple is unable to conceive. Moving on to the causes of infertility. In our country, Nigeria, then when a couple don't have a child, they normally start with the woman and say it's your fault, there's the reason why we don't have a child. But it can actually be the fault of the man or the woman. Let's look at the causes of female fertility. Condition that affects how much sperm is being produced. Problem with sperm reaching the female reproductive organ. This can be caused due to premature ejaculation or early ejaculation. Premature ejaculation is when the man reaches before expected time. Maybe on and off, the man is still like 30 to 1 hour with his wife, but the man finds himself in just maybe 5 or 10 minutes. It's known as premature ejaculation. There are certain factors of the environment, certain factors such as exposure to pesticides, chemical, radiation, or hot lamp or hot sun that can actually cause infertility and affect some of the cells and damage the cells of the man. The problem with cancer and its treatment. Cancer and its treatment, such as chemotherapy, can also cause infertility in man. Next slide. Female causes of infertility, condition of uterus. When there is swelling, this is where we normally get the case of fibroid, and a woman has fibroid, they actually lead to some swelling in uterus. The cancer and its treatment can also lead to female infertility. Fallopian tube damage or blockage. This is when there is swelling in the fallopian tube, and this swelling can be caused by an infection called pelvic inflammatory disease. Then we have ovation disorder. This is when the lady is having problem with her menstrual cycle or no cycle at all. When sometimes you can see a period this month on the 15th, then next month you see it on the 25 or ending of the month. Sometimes some people can stay 9 months without seeing their period and they're not pregnant. It's actually common because the ovation disorder is because of their infertility. The signs and symptoms. People do ask, how do I know I'm pregnant? Or when, as a upcoming doctor and nurse, very common come to the hospital and ask, how do I know I'm infertile or infertile woman? The main symptoms of infertility is not getting pregnant. But for some women, they have problem with their menstrual cycle or no cycle at all, no period at all. The woman can be tagged as an infertile woman. Or for men, some people have early premature ejaculation or having no sperm count. That is the sperm of the man. The man is supposed to produce at least 1 million cells, but the man finds himself producing like maybe 40 or 50 sperm cells. It can actually be a sign of infertility. And for an upcoming doctor and nurses, how do you diagnose someone? When someone comes to the hospital, how do you diagnose the person of infertility? For women, you can run a pelvic exam on them or blood test. You take their blood sample, go to the lab and check for hormonal imbalance or any form of problem a woman is having. You can have transvaginal ultrasound. You can insert a wand into the vagina of the woman to check for any form of hormonal imbalance in her. Then for men, you take the man, semen analysis, you take the man's sperm and go to the lab, run to test, check if the man is having low sperm count or not. Then blood test, take his blood sample and run test and check if he's having hormonal imbalance or any form of disease at all. Then you can still run and total ultrasound on the man too. Then treatment. If a patient or a couple come to your hospital as upcoming nurses and doctors, and we ask, how do you treat the person or what do you suggest the person do to cure infertility? For women, you can decide gestational career. This is when the woman has problem with her fallopian tube and the woman is unable to conceive. They can have a baby, it's actually not cerebral tumor that maybe somebody can volunteer or pay for the person to have their baby. Egg cell of the woman is taken and the sperm cell of the man fertilizes the egg and injected with somebody else, not the wife. But mind you, if you are taking the egg cell of the wife and not the other person. If you take the egg cell of other person and fertilize the sperm of the wife, automatically becomes another person's baby, not the woman's child again. So we can also take fertility medicine. Maybe because of the woman, maybe the woman has infection, she has a problem with infection, you can actually give her, recommend some medicine for her to take. Then in vitro fertilization, IVF, also known as test to babies. Then this is when the woman, egg cell of the woman, maybe this is when unexplainable fertility comes in. When the woman is okay, the man is okay, fertility test will not find any reason why the woman is unable to give them. You can actually they invite the person to go for IVF or test to baby. When the egg cell of the woman is taken and the sperm cell of the man is taken and into a petri dish and inserted in the woman for 2 weeks, the doctor will observe it, or you as an upcoming doctor will observe it and check for 2 weeks. If it forms an embryo, also a baby, then you can continue growing like that as a normal child. Then verify it on the surgery. So the difference was when the difference between inventive fertilization and gestational career. Gestational career, another person carry the baby. But inventive fertilization, you as the mother, you carry the baby. Then go for surgery. When you normally hear that people have fibroid, you have fibroid, you can go for surgery to cure their treatment. But for men, have lifestyle changes. Lifestyle changes in the sense that if your man have sex with your wife anytime, it's advisable, or as the doctor can advise the man to have sex with his wife during the period of ovulation. It's actually because we women were more likely fertile during our period of ovulation. So it's advisable, 90% chance that you can get pregnant or your wife can get pregnant during the period of her ovulation. Regular exercise. It's not that people with obesity are likely, they're likely more fertile. So you can go for regular exercise to burn some of the fat in your body to help. The medicine, if the man has problem with his sperm, maybe low sperm count or hormonal imbalance or early ejaculation, you as a doctor or the doctor will prescribe some medicine or drugs for you to take that will help you to boost your sperm. Then you have surgery, maybe the man has issue with his scrotum. For some people that have hepatitis of the scrotum, they can actually go for surgery to cure your infertility. Prevention and control. What do you advise as a healthcare practitioner or upcoming nurses and doctors? What your patients to do? You can advise them to eat a well-balanced diet, get treated of any form of infection, do not delay conception during advanced or until advanced age. Some people they will get married like, I want to enjoy my husband, I want to enjoy my wife for 5, 6 years. If maybe you forget that you are getting older, if you got married at an old age, you forget you are getting older. If you delay conception, there's likely a chance that you can get pregnant again. And you need exposure to environmental toxins. So people that work in bed to produce all these chemicals have to cover yourself very well because you can burn some cells in your system. Just like this. In conclusion, approximately 9 out of 10 couples get pregnant after undergoing fertility treatment. As a husband, this is not like for husbands now. As a husband, do not always encourage your wife. Do not say it's your fault, I don't have a child, it's your fault, I say 10 years, 20 years, I don't have a baby. Encourage your wife, do not blame her. If your parents can help her, both physically, emotionally, and psychologically, she can be strong. Always enjoy yourself. Always follow her and go. Encourage her. Stay around people. Always support you. It will help you physically and emotionally. Thank you.
Presentation, question, observation.
Very beautiful presentation. Sincerely, I enjoyed it. Thank you so much. I have a question. You said that most women tend not to see their menses 3, 4, 5, 6, 9 months. So I want to ask, what's the result of such and what's the way out?
Okay.
That's what I want.
But for people, maybe hormonal imbalance can actually cause for people infection.
Mike. Use your mic. Use your mic.
The infection can actually be leading to you lose your period again. You can actually cause them. You go to the hospital, they can actually give you some drugs. This infection, they can give you some drugs to cure your infection.
Okay, what about if a woman hasn't seen her menses for like 6, 5 months? Can such person go for IVF? You know, because you have to, your eggs need to come out before it breaks down and it comes out as menstruation, right? So I wanted to find out, is there a possibility that a woman will not see her, and is it most likely that when she goes for IVF becomes successful? I want to know that.
Yes, but there's the possibility of the woman not seeing your period for months. I have an auntie, she got separate from 9 months, but she was not pregnant. And not to know she had not given birth. Due to infertility.
No, my point is that at that stage, when she hasn't seen her eggs, if she goes for IVF, it will be successful. Because I know that they need to extract your eggs. friend of your husband and fertilize it, not an egg right? So that is where I want to understand. How is it possible? You are not seeing your menses. You don't ovulate. How is it possible to extract your eggs and fertilize one of your husband's sperm? Yeah,
Let me help at this junction.
Yes,
yes, wonderfully done so well. Thank you so much. There is no how and no way that you will not ovulate, you will not lay eggs. You understand? Usually when the women usually lay their egg is during the ovulation, immediately after the period. You understand? So if you are not really fertile down right, I say way, that's for. You remember when she started this thing, she said causes of infertility. She made mention of primary infertility and secondary infertility. This one we are saying is under the category of what? Primary infertility. You understand? So now it's just for them to get that, the egg, and get the child and the Odogu spermatozoa. Then they join the two together in the lab and everything will. There's no how you will not let it get. Okay? Thank you so much. Thank you.
Thank you for all conferences. Passion the officers. Why? For all the next time to prepare.
Hey everyone, my CEO, HR, my esteemed lady, and my fellow students. My name is Ashley of I'm here to present the MBFA titled Crohn's disease. Crohn's disease is a type of inflammatory bowel disease that causes the swelling of the tissue to your digestive tract.
Use your mind.
And it can lead to abdominal pain, severe diarrhea, fatigue, weight loss, and malnutrition. Inflammation caused by Crohn's disease can involve different areas of the digestive tract in different people, but most commonly in the small intestine. Inflammation often spread into deeper layers of the bowel. The exact cause of Crohn's disease is yet unknown. Previously, diet and stress were suspected, but now doctors know that these factors said they will aggravate factors like the immune system. Virus damage the immune system, which can trigger Crohn's disease. The hereditary Crohn's disease is more common in people who have family members with this disease. And the risk factor for Crohn's disease may include age. Crohn's disease can occur at any age, but it mostly occurs when you are young. Ethnicity. Although Crohn's disease can affect any ethnic group, but white people have a higher risk of getting it, especially people of Eastern Europe. Family history. There are higher risks if you have any members who have Crohn's disease, such as parents, or child. Cigarette smoking. Cigarette is the most important contributing risk factor for developing Crohn's disease. Then non-steroidal anti-inflammatory medication. This includes ibuprofen, diclofenac, naproxen, sodium, and complications of Crohn's disease may include bowel obstruction, that's a blockage in the intestine, ulcers, fistula, anal fissure, that's a tear in your anus, malnutrition, colon cancer, skin disorders, medication risks, then blood flow, then other health problems. Crohn's disease can also cause problems in other parts of the body. Among these problems are low iron anemia, that if you have low red blood cells, and arthritis. Signs and symptoms of Crohn's disease can range from mild to severe. They usually develop gradually, but sometimes will come on suddenly without warning. The symptoms include diarrhea, fever, fatigue, abdominal pain and cramping, blood in the stool, mouth sore, reduced appetite and weight loss, pain or drainage near or around the anus due to inflammation from a tunnel into the skin. And other signs and symptoms may include inflammation of skin, eyes and joints, inflammation of the liver or bile duct, kidney stones, iron deficiency, delayed growth of sexual development in children. And diagnosis. Doctors can diagnose Crohn's disease by collecting your blood for checking For checking if you have anemia, that is a condition in which they aren't enough red blood cells or to carry adequate oxygen to your tissue. There's two studies. You may need to provide a two samples so that your doctor can test for hidden blood. Colonoscopy. The test allows the doctor to view your entire colon and the very end of your ileum. Computerized tomography. You may have a CT scan or special X-ray technique that provide more details than a standard X-ray does. Magnetic resonance imaging, the MRI. An MRI scanner is a magnetic field and radio wave to create detailed images of organs and tissues. Capsule endoscopy. For this test, you swallow a capsule that has a camera in it, which takes picture of your small intestine and send them to the recorder you wear on your rug. Then the balloon-assisted endoscopy. For this test, a scope is used along with a device called a overtube. And the treatment, currently there's no cure for Crohn's disease, and there's no single treatment that works for everyone. The goal of medication is to reduce the inflammation that may trigger the disease. They include anti-inflammatory drugs, immune system suppressor, biologics, antibiotic, nutrition therapy, surgery, and other medication which include anti-diarrhea, pain relievers, vitamins, and supplements. Prevention and control. Quit smoking. Smoking can damage the intestine, which can lead to Crohn's disease. Exercise can build your immune system. Avoid medication that can trigger flare-up. Avoid food that may trigger unwanted symptoms, and caring for your mental health. In conclusion, Crohn's disease can be both painful and debilitating, and sometimes may lead to life-threatening complications. There is no known cure for Crohn's disease, but therapies can greatly reduce its signs and symptoms and even bring about long-term remission and healing of inflammation. Thank you.
Thank you. Please, Laloma. Question, observation.
Okay, well done, Hashimo. Your use of the word diagnose, take your patient doctor relationship or patient medic relationship a bit lower. You and Favor, is Favor around? Favor, you use the word diagnose, just like Hashimo. Diagnose. Diagnosis. Thank you.
Thank you very much.
Good day, everyone. My HOD, staffs present, and my fellow students. My name is Esther Okoli, and I'm here to present on the 10 paper titled Crimean Congo Hemorrhagic Fever. Crimean Congo hemorrhagic fever is a severe widespread disease caused by a tick-borne virus known as the norovirus of the Bonnieviridae family. It causes a severe viral hemorrhagic fever outbreak with a case fatality of 10 to 40%. It is endemic in Africa, the Balkans, Asia, the Middle East, south of the 50th parallel north, which is the geographical limit to this tick-borne, tick-principal vector. The virus is primarily transmitted to people through tick bites and coming in contact with livestock that are infected. Human-to-human transmission can occur resulting from coming in contact with the blood, the tissue, the organs, secretion, bodily fluids of an infected person. CCHF virus in animals and ticks. The host of the CCHF virus includes a wide range of domestic and wild animals, for especially livestock, which includes cattle, sheep, goats, etc. Many birds are resistant to this virus, but ostriches are susceptible and may show high prevalence of the infection. Animals become infected by the tick bite, and once they are bitten, it allows the tick-animal tick cycle to continue as long and as far as other ticks, get the chance to bite them. Although a number of tick genera are capable of becoming infected with CCHF virus, but the principal vector is identified as the hyaloma. Is identified as the hyaloma genus. Moving forward to the causes of CCHF virus. Just like I've said earlier, this virus is caused by an infection of the norovirus of the Borneo family. It was first of all characterized in the year 1944 in Crimea, which gave it the name Crimean hemorrhagic fever. Later, it was discovered in the year 1969 in Congo, which resulted to its present name, to the present name of the disease. Now, transmission of CCHF virus. The virus is transmitted to people either by tick bites or through contact with infected animal blood, tissue, organs, especially immediately during slaughter or immediately after slaughter. Majority of cases occur in agriculture, industries, livestock industries, vet hospitals, and livestock slaughterhouses. Human-to-human transmission can occur due to coming in contact with the blood, organs, tissue of an infected person. Hospital-acquired infection can also occur but due to improper sterilization of medical equipment, reuse of needles, and mishandling of organs, tissues, blood of an infected person. Zoonotic transmission at the human-animal interface from viral animal host to human is a public concern with a paucity of data in Nigeria. It's a zoonotic viral disease that is asymptomatic in infected livestock but causes a serious threat to humans with a mortality rate of 50%. Now, moving on to the signs and symptoms of CCHL. The length of the incubation period depends on the mode of the acquisition of the virus. Let's say, for instance, following infection by tick bite, the incubation period is usually 3 to 5 days, with a maximum of 9 days, and following infection by coming in contact with the blood, tissue, or organs of an infected person or animal, the incubation period is usually minimum of 5 to 6 days, maximum 13 days. But here are the onset symptoms that comes and show. We have fever, malaria, which is muscle ache, dizziness, neck pain or stiffness, headache, dizziness, sore throat. Then after 2 to 4 days, agitation may be replaced with sleepiness, dizziness, depression, lassitude, and the abdominal pain might later localize to the upper right quadrant. And also hepatomegaly, which is liver enlargement, can be visible in a patient. Also, the other clinical signs include tachycardia, which is fast heart rate, lymphadenopathy, enlarged lymph nodes. As you can see in my diagram where the arrow is pointing, that's an example of an enlarged lymph node. We also have a kind of rash which is called petechiae, a small flat red rash that causes bleeding under the skin. And if it is not being taken care of, it can result to a more larger rash, which can be identified as echinosis and other hemorrhagic phenomena. There is usually evidence of hepatitis, kidney deterioration, liver failure, and the mortality rate from CCHF is approximately 30%, with deaths occurring in the second week of illness. And patients who recover, improvements generally begin on the 9th or the 10th day of the onset of illness. Now, diagnosis and tests of CCHF virus. This infection can be diagnosed by several different laboratory tests. We have enzyme linked immunosorbent assay, ELISA. This is an immunological assay that is commonly used to measure the antibodies, antigens, proteins, and glycoproteins in a biological sample. We have antigen detection. This detection test can be performed directly on a variety of specimen types and are highly specific and rapid. We have reverse transcriptase polymerase chain reaction, RT-PCR assay. This is is a modification of the polymerase chain reaction, and it is primarily used to generate amplicon libraries for DNA sequencing by next generation sequencing (NGS).
Right.
Primary compound hemorrhagic fever is a severe chronic condition usually caused by a tick vector remaining in the bloodstream, causing severe viral hemorrhagic fever outbreak with a case fatality rate of up to 40%. Those affected will have to manage it as their recovery improves by treatment of symptoms, as there's no exact medication for the disease, because right now there isn't any exact vaccine for this virus. So the main approach to managing this virus and controlling it is by raising awareness on the risk and the prevention of the disease. Is also by attacking symptoms that usually come up, just like I mentioned earlier, symptoms like headache, dizziness, hepatitis, kidney deterioration, and liver failure, and so on. And also by raising awareness on the ways to prevent and control the spread of the disease. With all this information, let's try our best to reduce the way, and raise awareness on this virus, so as to reduce the risk of the spread of the disease.
Thank you. Question, observation. All right, thank you. Please clap for her.
Good day. Our head coach of estimate value, Dr. Colonel Mike, our head child, all the staff present, my fellow dear students, and ladies and gentlemen. My name is Ospope Chisom. I'm here to present a term paper titled High Blood Pressure, also known as hypertension. I'll be taking you through the definitions, the causes, the complications, the symptoms, and the treatments of high blood pressure. Okay. High blood pressure, also known as hypertension, is a common but serious health problem that affects millions of people worldwide. According to Wright in 2001, he stated that high blood pressure is a condition whereby the force of blood against the walls of the arteries is consistently too high. Let's take, for instance, the water hose we use at home for watering flowers and the pressure hose they use in washing cars. We all know that the level of water that comes out of the hose we use at home is not the same as the force at which the water that comes out of the pressure hose. So the funny part of it is that the force now is not happening in the pressure hose, but it's happening in our body. According to Centers for Disease Control and Prevention, it has been stated that a lot of people, both Americans, have high blood pressure, even nationwide, which has led to the research conducted by American Heart Association, and it has dawned on them that a lot of Americans have high blood pressure, but only a few of them have it under control. Next slide, please. Okay. In Nigeria, according to World Health Organization, it has been stated that about 30 to 40% of adults in Nigeria have high blood pressure. And we all know what that means. It means that high blood pressure is also a major health problem in Nigeria, just as it is in the United States. It's not only affecting the Americans, it's also affecting us here in Nigeria. Okay, let's quickly take a look at the types of high blood pressure. According to Cleveland in 2004, there are so many types of high blood pressure, but Cleveland has stated most of the types, and he's mentioned primary hypertension as one of the most common type of high blood pressure. And this particular type is usually common among elderly people. It is caused by age, lack of It is caused by age, lack of physical activities, and most of all, poor diet. They will have the secondary hypertension. The secondary hypertension is caused by some certain kind of medications we take, and it is also caused by underlying health conditions. Then we have the max hypertension. In max hypertension is actually a reverse of white coat hypertension. Max hypertension is a situation whereby your blood pressure is normal in clinical settings, but when you are at home, your blood pressure goes high. This particular type of hypertension is usually common among pregnant women, young adults, and people who are obese. They will have sustained hypertension. Sustained hypertension occurs whether you are at rest and calm. It's usually your blood pressure is usually high, whether in clinical setting or at home. And the set of people that are more likely to have the risk of developing this kind of hypertension is people that smoke and then drink. Then we have nocturnal hypertension. This type of hypertension is usually considered as the most dangerous of all these other ones, because this particular one happens while you're sleeping. And the major cause of this particular one is underlying health condition and medication timing. There are several people that like taking medication very close to their bedtime, which is not supposed to be so. So if you're in that category of people, I would advise you stop taking your medication very close to your sleep hours. Then we have white coat hypertension. Like I said, it's a reverse of max hypertension. In this situation, your pressure level goes high when you're in the hospital. Like there are some people, once they hear that they have an appointment with a doctor, they become anxious and they're already stressed out. So when you have an appointment with your doctor, I would advise you stay calm and take a chill pill and you'll be fine. Next stage. Okay, still according to Cleveland, he has stated most of the categories of high blood pressure, which are also known as the ranges of high blood pressure. I will quickly explain systolic and diastolic because I've been making use of the terms. So, systolic is when your heart contracts, and diastolic is when your heart is at rest. Let's use football or your car tire for instance. When you're adding air to your car tire or when you're adding air to your football, that is the contraction. Then when you're deflating your car tire or when you're deflating the air in your ball, that is when the heart is not at rest. So for the normal blood range, we have your blood range will be less than 120 millimeter mercury for systolic and less than 80 millimeter mercury for diastolic. When it's elevated, your blood range will be between 120 to 129 for systolic and 80, less than 80 for diastolic. When it now enters hypertension stage 1, your blood pressure will now range between 130 to 139 for systolic and 80 for diastolic. Then when it enters hypertension stage 2, the blood level now ranges between 140 or higher for systolic and 90 for diastolic. Then if it enters hypertension stage 3, which is also known as the crisis stage, your blood range will now be 180 or above for systolic and 120 or above for diastolic. Once you reach this level of hypertension, this crisis stage, you require immediate medical attention, and it only takes the grace of God to sustain a patient at this level. Then we have the factors and causes of high blood pressure. There are several factors that can cause high blood pressure, according to Lane in 2012. He said lifestyle factors that can cause high blood pressure. And under these lifestyle factors, we have smoking, we have drinking, we have poor diet, we have irregular physical exercise. And for health conditions, we have conditions like thyroid disorder, sleep disorder, we have so many of them. For genetic factors, we have obesity, we have age, and we have several other ones. Then we have hormonal and biological factors which include hormonal imbalance, inflammation, and thyroid disorder as well. So moving further, we'll look at the symptoms of signs and symptoms of high blood pressure. It is stated by Wilton et al. 2017 that high blood pressure do not usually show symptoms in most cases. It's only when, which is also the reason why they call it a silent killer, because it does not show you symptoms until it has reached to some certain points. But people with more severe case of this hypertension may experience headache, nose bleeding, loss of vision problems, chest pain, shortness of breath, and even dizziness. Next slide, please. Then going further, we'll quickly look at the diagnosis of high blood pressure. Okay, the diagnosis of high blood pressure usually involves taking the blood pressure measurements over a period of time. Your healthcare provider will now measure your blood pressure either with the use of Pigmore manometer measurement, which is a standard method where a healthcare provider uses a curve or a pressure gauge to measure your blood pressure over a period of time. This measurement is usually done at least twice before you can diagnose hypertension. Your healthcare provider may also recommend the use of ambulatory blood pressure monitoring. This method now involves wearing a portable device, just as seen on the diagram there. The work of the portable device is to take your blood reading several times over 24 hours, which will give a comprehensive picture of your blood pressure. Throughout the day and night. So in essence, both methods are usually helpful because they will help you diagnose hypertension, getting you different variations from different causes of hypertension. They will look at the complications of high blood pressure. According to Montana 2019, he mentioned several complications of high blood pressure. They will have heart attack, we have stroke, we have kidney damage, vision loss, and peripheral artery disease. This peripheral artery disease that I mentioned here is a situation whereby the arteries are responsible for transporting blood to your arms, mostly to the leg and narrow, making it difficult for blood to flow through. So, next slide. We'll now look at the prevention and treatments of high blood pressure. There are several preventions and there are so many ways you can treat high blood pressure. I mentioned some lifestyle changes which you can practice to help you manage or treat high blood pressure. And I have eating a healthy diet, engaging in physical exercise, quitting smoking, and limiting your consumption of alcohol, then reducing stress and managing a healthy body weight. Next slide. Okay, in conclusion, like I mentioned earlier, I mentioned that hypertension is a very common condition that has affected many people nationwide and has even led to the death of so many patients. So it is important for you to note the causes, the symptoms, and the complication of high blood pressure, and so that you can prevent it. Then there are some medications that you can also use to maintain this high blood pressure. But I will advise you meet a healthcare provider to recommend the suitable medication given based on the patient's range of hypertension. Thank you.
For her. Question, observation. Okay. Adelerian Jemima Adesayo.
There is question. It is so pathetic, very, very pathetic that you had a very good presentation, but
the medications for treatment of hypertension were not mentioned.
Okay, we can use some medications like ACE receptor.
What is ACE receptor?
That is why I mentioned earlier, you have to meet a healthcare provider for them to recommend.
But we don't know anything about your presentation. You're supposed to have informed us very well. Okay. Yeah, she had reference. What is the other name for the high blood pressure?
Hypertension, sir.
The medical terminology for that. I've said this time without number here. Okay, that is tachycardia.
You can't say it, so I will take
Tachycardia.
Tachycardia. Okay, sir.
Tachycardia.
Thank you, sir.
I don't deserve an applause. Look at these people. Thank you.
Present and my fellow students. And by name Adeniran Jemima Adebusayo, I'm here to present a 10 paper titled Kidney Failure. Kidney failure, also known as renal failure, is a condition when the kidney can't perform its functions. Kidney is responsible for filtering waste products and fluids from our blood, and when it can't do that, it's built up in our body. Causes of kidney failure, we have that high blood glucose, also known as high blood sugar, damages the blood vessels. And when the blood vessels are damaged, they can't filter waste products and fluids from our body. And when they get damaged, the kidney tries to struggle to perform its function, leading to CKD. And when it gets worse, it then moves to kidney failure. Chronic kidney disease. When the kidney begins to lose its function, they can't filter waste products and fluids. And like I said earlier, it occupies the body, leading to kidney failure. Then high blood pressure. It constricts and narrows the blood vessels, and then it damages them throughout. It weakens and narrows the blood vessels, which eventually damage them. When it damages them, then it narrows the blood vessels, and then it includes the kidney. That means this high blood pressure can also damage the kidney, like damage it, that it can't be, that it need immediate transplant. Causes of signs and symptoms of kidney failure: fatigue, feeling tired, weak. Even after resting, you are still tired. Weakness, feeling weak, frail, and tired. Changes in urination, like the colors. Changes in urination, darker or tea-colored urine is due to blood or bilirubin. Bilirubin is a yellow pigment produced when the old red blood cells in the liver are they want to replace themselves in the liver. You want to nausea, poor appetite, not eating, lack of interest in eating. Then change swelling of the body, swelling in the legs, ankles, wrists, and other parts of the body. Treatment of kidney failure. Angiotensin and converting enzymes. They reduce the toxins and the waste products in the body, so that it don't get occupied in the body. Diuretics, also known as water pills. They remove excess fluids and sodium in the body. Kidney transplants. When the kidney gets damaged, you need immediate kidney transplant, like a healthy kidney must be replaced in the body. Maintaining healthy diet, maintaining healthy weight, like checking your weight to see if you are healthy, and eating healthy food, eating balanced diet, make you have prevent and treat kidney failure. Next slide. Exercising, blood pressure medication such as diuretics, ARCB, ACE, water pills, also known as diuretics. Manage other health conditions like diabetes and high blood pressure.
like you take the drugs that help prevent and treat high blood pressure, such as Durex, ACE, ACRS, and so on. Eating the healthy food, like eating balanced diet, taking your balanced diet, control your blood pressure, going like regular checkups in the hospital, checking your blood pressure, like the level of your blood pressure, and so on. Next slide. Kidney failure is a serious condition that can be caused by different conditions such as diabetes, high blood pressure, and so on. And the symptoms are swelling, increased changes in urination of the body, fatigue, weakness, and then the treatment for kidney failure includes dialysis. Like once the kidney gets damaged, you then need like a dialysis or a kidney transplant immediately. Else. Then prevention. Prevention is also important to also like take your medications that are prescribed by the doctors. You prevent kidney failure by taking medications like Durex, Durex, eating healthy diet, taking healthy food like vegetables and so on. Thank you very much.
Please clap for her. Question, observation.
Go, please. Go. Slowly. Slowly. Go. Go. No. Come back. Slowly. Go. Go. Okay, stay here. Okay, this is treatment. What is hypertension converting enzymes? What does that mean? Inhibitors. So you are passing message to the people to understand your own topic, your presentation. What is hypertension converting enzyme? The treatment for what?
Kidney failure.
So, is it a medication or what? I want to understand.
It's a drug.
It's a drug. Is there any drug called like ACE?
Yes.
There's a drug called ACE.
Yes.
No, I don't know.
There are drugs containing ACE.
You sure of what you're saying?
Yes, there are drugs containing ACE.
But not ACE.
There is nothing like drugs. Please, she's not the first time. This is classification of the drug, not the name of the drug. Angiotensin converting enzyme is a classification of captopril. Okay? It's not a drug, it's a classification of drugs. There are some drugs under this name of this, the name of this category. Then you come again, angiotensin 2 receptor blockers. Is that the name of the drug? That's not the name of the drug. It's also classification of a drug, which is so certain. So if you are coming out, it's okay you mention angiotensin receptor, e.g. losartan. Angiotensin converting enzyme, e.g. captopril. So people will be guided. Okay? Then secondly, what is the other name for kidney? The medical term for kidney.
Yes.
You mentioned it here now. I just want to know whether you prepare your slide or somebody prepared it for you. Who prepared your slide for you? Then what's the name or other name for the kidney? Then where were you before? Canada. Thank you so much.
Adija Yusuf.